Diabetes remains a pressing issue that requires attention even during the night. In fact, evening hours can reveal certain symptoms that everyone with diabetes should be well aware of. It's crucial to recognize that these signs are significant for timely treatment and normal sleep. Let's focus on 9 nighttime symptoms to be mindful of in the context of diabetes, as it, unlike us, does not sleep. One of the first signs of diabetes is excessive night sweating. Many people with diabetes experience night sweats, even if the room is cold. This is one of the signs of nocturnal hypoglycemia, or low blood sugar levels at night. Several factors, such as certain medications, uneven eating, or intense evening exercises, can contribute to this. Waking up in sweat not only disrupts a good night's sleep, but also indicates dangerously low glucose levels in the body. To effectively deal with night sweating, it's crucial to closely monitor your blood sugar levels, especially in the evening. Identifying and adjusting potential triggers are key steps. In addition to this, night sweats can be facilitated by a lack of balanced nutrition, evening exercises, and medications with certain side effects. If it's related to medication intake, adjusting the dosage with a doctor is advisable. An important precaution is having an accessible source of glucose, such as glucose tablets or juice, which can be life-saving in case of nocturnal glucose fluctuations. Before moving on to other symptoms, don't forget to like this video and subscribe to our channel. The second sign is nocturnal hypoglycemia. This refers to a drop in blood sugar levels at night. The difficulty is that the drop often goes unnoticed. If the disease is ignored and blood sugar levels are not monitored, you may encounter unpleasant symptoms. Symptoms of nocturnal hypoglycemia can include sweating, vivid dreams, and a headache upon waking. Prolonged periods of nocturnal hypoglycemia can lead to seizures or even loss of consciousness. Monitoring blood sugar levels, especially before bedtime, and proper nutrition play a vital role in preventing this condition. Sharing information about the signs of severe hypoglycemia and first aid methods with friends and family is also crucial for maintaining the health of diabetics. The third sign is nighttime cramps. An unpleasant manifestation for people with diabetes is muscle cramps that occur during nighttime sleep and are accompanied by acute pains, most often in the legs. The appearance of such symptoms can be related to unstable blood glucose levels, circulatory disturbances, or diabetic neuropathy. To combat nighttime cramps and prevent their occurrence, it is very important to carefully monitor blood sugar levels, as nerve disorders caused by prolonged high blood sugar levels can trigger cramp-like manifestations. Regular monitoring of blood glucose levels and strict adherence to the doctor's recommendations for medication use can help control blood sugar levels. Doctors may also recommend performing light stretching exercises before bedtime, especially for calf muscles. To prevent cramps, it's beneficial to maintain optimal hydration, consume balanced amounts of minerals such as magnesium and potassium, and wear comfortable shoes. Warm baths or good old-fashioned heating pads can also ease cramps, doctors say, but it's best, in the event of night cramps or their intensification, to seek a doctor's consultation to identify the causes and get appropriate recommendations. I remind you that consulting a doctor and following the recommendations of evidence-based medicine are the only correct solutions in the fight against various diseases. The fourth sign is restless leg syndrome. Restless leg syndrome is a neurological condition characterized by a constant urge to move the legs, often accompanied by sensations of tingling, itching, and crawling ants. This discomfort is especially felt during rest periods and can be unpleasant, particularly at night. In people with diabetes, there is a link between this syndrome and peripheral neuropathy, which is a common complication in cases of chronically high blood sugar levels. Relief from restless leg syndrome in diabetic patients requires a comprehensive approach. First and foremost, maintaining optimal blood glucose levels can reduce the risk of neuropathy and, consequently, its spread. Additionally, lifestyle changes, such as limiting the intake of caffeine and alcohol, can reduce the symptoms of restless leg syndrome. It is known that regular moderate physical activity is beneficial, but excessive activity can worsen the condition. Some patients find relief through leg massages, the use of warm or cool compresses, and the practice of relaxation techniques, such as meditation. The fifth sign, most important, frequent urination. Frequent nocturnal urination is an important symptom to note, as it can indicate serious health issues. For example, in diabetes, Nocturia often occurs due to excess sugar content in the blood, leading to increased urination frequency. The kidneys perform a very important function. They filter glucose from the blood. If the glucose level becomes too high, the kidneys actively begin to get rid of its excess through urine. This process not only increases the volume of urine, but can also disrupt sleep due to increased frequency of nighttime bathroom visits. Such symptoms require special attention, especially in people with diabetes or those predisposed to its development. It may indicate insufficient control of blood sugar levels or the onset of diabetes. Regular monitoring of blood sugar levels under the guidance of a doctor plays a crucial role in determining a strategy for controlling glucose levels in the context of medical treatment, dietary changes, and lifestyle adjustments. In turn, this can help reduce nocturia, as well as improve overall health and sleep quality. The sixth sign: disorientation upon waking. Confusion or disorientation upon waking, a feeling of bewilderment often referred to as morning fog, should be taken seriously, as it can be a significant nighttime sign, especially for people with diabetes. Nocturnal hypoglycemia can be the cause of confusion, as blood sugar levels drop to a minimum during sleep. The brain, needing glucose for energy, becomes less efficient due to a lack of glucose, which can lead to confusion and disorientation after waking. For patients suffering from diabetes, it is important to carefully monitor blood sugar levels before bedtime and upon waking to determine a possible link between these indicators and low nighttime blood sugar levels. If such a link is confirmed, a doctor may suggest making changes to diabetes treatment, for example, changing the timing or dosage of medications, as well as altering the choice of evening snacks to prevent nocturnal hypoglycemia. The seventh sign: headaches at night and upon waking. Headaches can be not only a common inconvenience, but also a signal of serious problems, especially in people with diabetes. Nighttime headaches, as well as pains upon waking in the morning, may indicate possible nocturnal hypoglycemia, when blood sugar levels drop to a minimum during sleep. Since the brain is particularly dependent on glucose, its deficiency can cause a headache, signaling distress for diabetics. Especially important is monitoring blood sugar levels before bedtime and after waking. The appearance of morning headaches can be considered a sign of excessively low nighttime blood sugar levels. To stabilize glucose levels during sleep, a doctor may not only adjust dinner, but also develop a meal plan or prescribe diabetes medications. It is also worth noting that in addition to problems caused by diabetes, morning headaches can be due to dehydration. But if the headache persists due to poor sleep or sleep apnea, it is important to consult a doctor for proper diagnosis and selection of effective treatment, which should ensure optimal sleep quality and diabetes control. The eighth sign: nighttime thirst. Some diabetics suffer from increased nighttime urination. Thus, the body tries to get rid of excess glucose. This is an alarming signal. Possibly the blood sugar level is outside the optimal range. Frequent trips to the toilet harm sleep, leading to fatigue and decreased productivity. To deal with the problem, specialists advise monitoring sugar levels and not drinking a lot of water or other beverages before bedtime. Due to the diuretic effect, strong tea, coffee, and alcoholic beverages taken in the second half of the day can provoke nocturia. Meanwhile, diabetics may experience strong thirst at night. In general, the desire to drink water and nocturia are interconnected symptoms. The ninth sign: sleep apnea. A patient with sleep apnea periodically stops breathing or takes shallow breaths during sleep, causing them to wake up. An increasing number of studies support the hypothesis that habitual snoring and obstructive sleep apnea have an effect on glucose metabolism in both diabetics and healthy individuals. Apnea can cause insulin resistance and increase the risk of developing type 2 diabetes. Autonomic neuropathy, present in 30% of diabetics, appears to play a role in the development of sleep-related breathing disorders. Obstructive sleep apnea is often associated with obesity, a risk factor for the development of type 2 diabetes. To improve their condition, a patient should lead a healthy lifestyle. Medicinal methods also help. A person feels better after losing weight. Thus, understanding the importance of diabetes control during nighttime rest is an integral part of caring for one's health. Recognizing and analyzing nighttime signs play a decisive role in maintaining well-being and preventing potential complications. That's all. But many interesting videos await you on my channel. So, don't forget to subscribe to it and like it.